Turning now to the deadly Ebola outbreak, which is spreading rapidly in East Africa. According to the World Health Organization, there are now more than 900 suspected cases and 220 suspected deaths associated with the outbreak that was declared 10 days ago. Now, to give you a sense of the speed of the spread, it took nearly 4 months to reach those numbers during the 2014-2016 outbreak in West Africa, which killed more than 11,000 people. Today, the head of the WHO said the epidemic is, quote, outpacing us, and the International Rescue Committee, an aid group that works in the region, is warning that this could become the deadliest Ebola breakout on record without urgent international action. Joining me now is Dr. Craig Spencer. He's an emergency doctor and a public health professor at Brown University. He's a survivor of Ebola. He contracted the disease while caring for patients in Guinea in 2014. Dr. Spencer, there are a few people who know as much about this disease as you, so we're very pleased that you're here to join us. How concerned are you by the number of cases that we're seeing, and do you agree with the IRC's assessment that this could become the deadliest outbreak on record?
I'm incredibly concerned. Let me tell you why. Just over 10 days ago, we didn't know about this outbreak. And in the span of just a few days, it became one of the biggest outbreaks ever. And I suspect the 1,000 or so cases that we are reporting now is probably just a fraction of the actual true cases on the ground. We don't have enough teams or epidemiologists or testing to be able to actually determine how many cases and how many deaths there are. And there are so many different chains of transmission that we haven't tied all together. So I don't even think we, quite frankly, have a decently clear view of what's happening yet. And I don't think that's going to get clear probably for another week or two.
Now, this Bundi-Bujo strain is different than the Zaire strain, which you contracted in West Africa 12 years ago. But just explain to us what it's like to have Ebola. What was your experience like with the disease?
It was the worst 19 days of my life. There's no other way to sugarcoat it. But that being said, I had the best case scenario of a worst case scenario in that I was treated in a high quality intensive care unit back in the U.S. And I keep thinking about the fact that hundreds or thousands of patients, not only in West Africa a decade ago, but in the coming weeks and months in Eastern Congo, are going to be treated in facilities that pale in comparison to what I was lucky enough to be treated in. And I think that really argues for exactly why we need to step up this response as quickly as possible. There are humanitarian organizations that are trying to flood into the area. It's going to be difficult. It's a tough place to work and get access to. But even if we have all the resources, all the money, all the humanitarians, all the coordination, it's going to be really hard to step up quick enough the level of care that we need to be able to provide to not only gain the trust of the community to show them we have something to offer, but to make a measurable dent in this outbreak.
I want to put up a quote from an opinion piece that you wrote for the New York Times where you say, quote, "I know how destructive the disease can be and how unprepared we are for its return." Why is it that dealing with several past Ebola outbreaks, how is it that we're not prepared for this one?
We seemingly keep forgetting the lessons we've learned and unlearned multiple times before. A decade ago, we learned the value of smart investments, being prepared, what happens when we're flat-footed. We saw this over the past year with the amount of support that the U.S. primarily and other countries as well have pulled out of countries like Eastern Congo and the impact it's had on not only the detection, but our ability and swiftness to respond. And there are incredible human costs here. When we talk about this on the news here in the U.S. and in other countries, we look at the case numbers, we see pictures of people in treatment centers. It's hard for us to really grapple with the reality of what this looks like on the ground. But as providers, as people working in clinics right now without enough personal protective equipment or worried about their loved ones, their colleagues, their friends, this is a horrific and cruel disease. It is absolutely horrible, unlike anything any of us should ever have to experience. And all of that points to the importance of all of us doing whatever we can to marshal the resources necessary to make sure we can intervene in this outbreak as quickly and as forcefully as possible.
Now, administration officials have pushed back against the idea that there's any link between U.S. cuts to global health and the scale of this current outbreak. Instead, they've pushed the blame all off on the WHO for being too slow to sound the alarm. What do you make of that assessment?
I think it's embarrassing that an administration that pulled out of the WHO doesn't even know what the WHO's role apparently is, because that's not their role to detect this outbreak. It's to alert other countries. Now, anyone saying that the U.S. pullout did not have an impact here has no idea what they're talking about and has no idea what it's like working on the ground in Eastern Congo. I can tell you 100% that without those resources and that support, it has left the administration flat-footed, but also Eastern Congo and the clinics and providers that are there right now that I'm talking to every day without the resources they need to promptly end this outbreak.
So we only have about 30 seconds left, but the State Department has said that they're going to fund 50 treatment centers. They're going to put $23 million towards containing the outbreak. Is that too little, too late, or will it help?
The State Department said that on Twitter, and then the Ugandan Ministry of Health had to correct them because the Ugandan Ministry of Health said you did not talk with us, and we knew nothing about this. This is just a cover-up. This is to make it look like we're doing something. We need something more than a proxy for looking like we're doing something. We need to actually do something, and we need less lip service and more boots on the ground.
Okay. Dr. Craig Spencer, who survived Ebola and knows firsthand about that experience, we appreciate your expertise on this topic, sir. Thank you so much for joining us.
Thank you.
We thank you for watching. And remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.